Good morning. Welcome to the Department of Human Services panel presentation, Thriving Together During COVID-19, ʻOhana Nui Approach to Equitable Futures. My name is Maureen Hall. I am the Policy Director at the Department of Human Services. I'll be the facilitator for this session today. I'd like to thank the conference sponsors for inviting DHS to present today. I'd like to also thank you, all the participants of this session, for your commitment and the work you do every day to support the residents of Hawaii. As a reminder, all participants are muted throughout the webinar to avoid any feedback and echo during the presentation. We have some time reserved for Q&A at the end. Please use the Q&A pod to post your questions along the way. If you have a particular speaker you are asking your question to, please indicate the name of the speaker. Malia Tom-Dinick, Project Specialist, and Catherine Korinaga, Community and Project Development Director, will moderate the Q&A during the presentation. We might not be able to answer all the questions during this webinar, and we will provide written responses which will be posted on the conference website, along with the final slide deck and additional resources post-conference. Thank you in advance for your patience. Now, I'd like to introduce today's speakers. Our director, Cathy Betts, will begin and end today's presentation about overall DHS efforts. Meredith Nichols, Assistant Administrator, Deputy Medicaid Director of the MedQuest Division, will discuss Medicaid. Brian Donohoe, Administrator for the Benefits, Employment, and Support Services Division, will discuss food and cash assistance programs. Maureen Bates, Administrator for the Division of Vocational Rehabilitation, will discuss the programs and services the division offers. Now, without further ado, I will turn the mic over to Director Betts to start up the presentation. Cathy, the floor is yours.
Thanks, Mimari, and thanks everybody for being here today and joining us for this presentation. Myself and our division administrators that are presenting today are really excited to share some of the information that we've learned throughout this pandemic and some of the ways that we have really kind of changed the way we deliver services to the residents of Hawaii. So today we're going to be discussing some basic foundational tenets that ground us, share some information how the pandemic impacted the work we do, and we're going to finish up the presentation by discussing how we can envision a new economy of well-being that is rooted in empathy and compassion. So we recognize that we have a constitutional obligation under Article 9, Section 3 of the Hawaii State Constitution, which states that the state shall have the power to provide financial assistance, medical assistance, and social services for persons who are found to be in need of and are eligible for such assistance and services as provided by law. So we recognize that we have that constitutional obligation, and you'll note that it doesn't say citizens in need, it says persons. So we note that this is important because in our state we do serve non-citizen and mixed citizenship households, so it's important to note that. And this is one of our guiding principles and foundational tenets that ground us. Next slide, please. And we're also guided by the underpinning of doing direct services by treating people with aloha. And here we have the statutory provision of the Aloha Spirit by Auntie Pilahi Paki. Aloha Spirit is the coordination of mind and heart within each person. It brings each person to the self. Each person must think and emote good feelings to others. So this is what we really strive to do. We recognize the importance of empathy and treating people with dignity, and this is really what we strive for. And part of that, as really reflecting on events that happened last Sunday, part of that is destigmatizing poverty, destigmatizing homelessness, and exposing that there is no shame in receiving assistance. And I think you'll see that really in the collective work that our division administrators will be sharing. Next slide, please. We've also been working over the last 4 years to truly ensure a multi-generational framework is utilized when we provide services. So this framework allows for crucial shifts in thinking so that we are able to break down silos of service delivery and government. And I think the first step in really understanding that is to recognize that many of us have been trained to think in silos. So changing that framework and mindset has allowed us to truly explore innovative and creative ways to provide service delivery. And really that goal is to have no wrong doors. So we don't turn folks away when they're not in the right office or they're not calling the right number. So in 2019, we were able to codify this language into our founding statute. And part of that is using an integrated and multi-generational service delivery to reduce the incidence of intergenerational poverty, dependence on public benefits, and improve social well-being. Next slide, please. So this is DHS on one slide. We recognize that we're a large department. We serve 1 in 4 Hawaii residents. That's pre-pandemic, and obviously that has increased. We have a $3.6 billion budget, 84 offices statewide, 4 divisions, 2 attached agencies, 2 attached commissions, 6 staff offices. Generally, we have about 2,400 positions. Right now, we have about 1,900 roughly filled. And we have a multi-generational staff, which I think is important to note because that has really assisted us in pivoting to telework and really exploring ways that we can support technological capacity of our employees. Next slide, please. And you can see that the CARES Act funds were largely devoted to health and human services. We also received grants for our existing federal programs and also additional coronavirus relief funds. So we're tracking multiple sources of federal funds, many different services and purposes. And all DHS staff have served a really crucial role in creating mechanisms to ensure that money is spent. As many of you know, as you might be contracted providers or community organizations, I'm sure you all know that state government and procurement is not designed to pump out money quickly. So our team needed to change process, protocol, forms, etc. And on top of that, doing their normal daily jobs to ensure the funds get out to those who need them. Next slide. So this is an eagle's eye view of what programs, services, and offices comprise all of DHS. Currently, we have roughly 1,900 employees, as I mentioned earlier, $3.6 billion budget, and that's largely made up of federal funds, about 66%. So you can see these are our 4 divisions and the benefits and services that they provide. So we have the Benefit, Employment, and Support Services Division, MedQuest Division, Division of Vocational Rehabilitation, Social Services Division, which oversees child welfare and adult protective services. And all of these divisions are governed by different federal oversight agencies and federal regulations. So we additionally have split federal state funding programs, which are required by federal law. These are our attached agencies. We have Hawaii Public Housing Authority, Office of Youth Services, which also includes Hawaii Youth Correctional Facility, also known as Kauailoa, Youth Commission. We also have attached to us the Hawaii State Commission on the Status of Women, the Hawaii State Commission on Fatherhood, the Interagency Council on Homelessness, and Governor's Coordinator on Homelessness. And we are extremely proud of the work that they do. So going back to our earlier slide, where I reflected on the work we've done to introduce and explore our multi-generational framework, this really requires us to look at the social determinants of health and well-being and to concurrently provide supports to the entire family unit, recognizing that we cannot treat homelessness or access to food as separate from something like health insurance or knowledge of one's own rights under the law. So this really requires embedding that framework throughout our DHS division, staff offices, attached agencies, and commissions to transform every aspect of DHS service to a whole family approach. And I really like to think of ʻOhana Nui as a starting point and a destination. So if we've done it well, we get to our desired state in which families are set on paths towards self-sufficiency and wellness. So facing the challenge, quick pivot. And I feel like everybody's saying it right now. So I feel like I'm transported back to earlier dance classes as a teenager. So we anticipated the department-wide challenges early on. So we began having daily meetings with all divisions and staff offices to create a plan. This was back in February when we saw what was happening on the continent. We anticipated the pandemic, its impact on residents early on, recognizing the different federal regulations that really sometimes, they're there for good reasons, but we were going to have to apply for waivers in order to have more flexibility and nimbleness in providing those services to residents. So we needed to anticipate increased needs, not just needs of the residents, but of our staff as well. We also began communications with contracted providers on anticipated impact on their work, communicating with staff to ensure we were being transparent in what was going on, procuring PPE aggressively so that all of our neighbor island staff offices would be able to have access to it, working with ESF 6 to communicate the increased needs of our clients. We shifted to telework. We decreased numbers of staff in offices. And as I mentioned, we were very aggressive about purchasing and procuring PPE so that we could ensure that folks were safe when they were doing their frontline work. As you know, many of our employees are essential workers. They are frontline staff. They are folks that are going in to do removals of children from situations of abuse and neglect. We had folks hitting the pavement to look for missing foster youth and folks who are being sex trafficked. So we were able to really quickly anticipate those needs and early on plan to see how we were going to actually deliver the services and evolve really our process that we had kind of become entrenched in pre-pandemic. So to go into more detail on how we were able to meet the increased needs, I'm going to turn it over to Meredith Nichols now from MQD.
Aloha, thank you so much, Cathy, for that excellent foundation. And thank you to all of you who are attending this session. In fact, attending this conference in general, each one of you clearly is interested in being a part of the solution for our houseless community. And the Department of Human Services absolutely shares that commitment. Next slide, please. From a MedQuest perspective, I wanted to share with you that when we look at what we're experiencing in terms of increase in applications and compare that to our application count from 2019, you can see from this chart here that statewide, we're at an increase of 31% over what we experienced in 2019. And that increase varies by county, where we see Maui County at 54% increase over last year in applications, followed by Kauai at 48%, and then Oahu at 29%, and Hawaii Island at 11%. Next slide, please. And I wanted to demonstrate a little about that application increase. So this chart starts in March because we know that that's when Hawaii started experiencing the impacts of pandemic and shutdown. So the green line is 2019, and then this purple line is the same time period, that same week, but in 2020. And you can see in March that huge spike early on when people initially were out of work and lost employer-sponsored insurance. And you can see the increased numbers have persisted. And then you look all the way to the right-hand side of the chart, and you see this extraordinary and extreme spike starting in November, at November 1st. And I wanted to just spend a moment talking about what that is. What we're seeing there, and you see also a similar spike in 2019, that has to do with our open enrollment period on the marketplace. Next slide, please. So the marketplace open enrollment, this is also what people call Obamacare. This is a critical component of our healthcare spectrum for the state. And so you might wonder, why is Medicaid talking to us about Obamacare or the marketplace? And I wanted to share with you, number one, there are these critical dates coming up. The marketplace is only open from November 1st through December 15th. That's the 45 days where people who are uninsured can apply for insurance coverage there. So why does it matter? It matters because not everybody is going to qualify for Medicaid. And if you don't have insurance and you're not eligible for Medicaid, then the best next place to go get your insurance would be on the marketplace. So we wanted to draw all of your attention to this for yourselves, for the people that you're serving in the field. This is the time for those not eligible for Medicaid. This 45-day period, and we're under a month now, is the time to get that health insurance. You can apply online at healthcare.gov, or for people who don't have access, they can also call and apply over the phone by calling 1-800-318-2596. I want to draw particular attention to a segment of our population. We know that there is no federal support for COFA migrants on Medicaid if you're between the ages of 19 and 64. So if you're a child and you're a citizen from one of the compact nations, so the Federated States of Micronesia, the Republic of the Marshall Islands, the Republic of Palau. If you're from one of those nations, you're a child and you financially qualify for Medicaid, no problem, you're covered. If you're an elder, 65 or older, you can also be covered in our state. Or if you're disabled or blind or pregnant, you can be covered on Medicaid. But if you're working with people or you yourself are between the ages, in that community, between the ages of 19 and 64, otherwise healthy adult, then the marketplace is the place to get that insurance. And there are special plans there to make it affordable, premium subsidies that help take care of the premium. And the state also has a premium assistance program that helps round out and continue coverage for the rest of the premium. One last plug on this. If you're living in poverty, if you're below 150% of the federal poverty level, the best plan to choose when you register on the marketplace is a silver level plan. There are 4 metal plans. The silver plan is the one that leverages the most benefits and does trigger the state's premium assistance plan. So there's more on that, but I wanted to just alert you briefly to this important opportunity. Again, the deadline comes on December 15th, so less than a month away. Next slide, please. So now I'm pivoting back to Medicaid, and I wanted to show you on this chart that in March, you will see in the purple line this gradual and steady increase in our actual enrollment. So this is different from applications, right? These are people who applied and became eligible and are enrolled. Something else I want to draw your attention to is once you're enrolled in Medicaid, as of March 18th, 2020, if you were enrolled in Medicaid or became enrolled after that, you will not lose your Medicaid coverage unless you move out of the state, you pass away, or you request to be removed from Medicaid coverage. And that is why you see this continued increase, because nobody's coming off during this public health emergency. Next slide, please. And then I wanted to also show that to you by county. So overall statewide, if you look at like a point in time, this is just looking at November 15th of last year compared to November 16th of this year. Statewide, we have 16.95, almost 17% more people enrolled. And then you see how that breaks down county by county. Next slide, please. And then finally, I just wanted to acknowledge some of the work during pandemic that Department of Human Services and MedQuest has also done is really prioritizing staff and client safety. Implementing COVID-19 related federal authorities and exemptions to care for our people in the best way we can and to support the providers and the community. And some of the ways we've done that is continued investment in technologies and processes to telework and to make sure we can assist people, but remotely so everyone is safer. And modifying our policies and operations, like I just talked about, to make sure people are staying enrolled during this public health emergency. And then, of course, all of you partnering with other people, other entities, other agencies, health plans in the community to make sure we're all coming together in support of the people. We mentioned here in particular the creation of these Go Kits. And we're really proud to have done that. And with that, next slide. I want to pass the ball along here to my colleague, Brian from BESD.
Hey, thank you, Meredith. I really appreciate it. And again, thank you all for attending, and we do appreciate all of the work that you do in support of all of our residents. I'd like to give a nod to Director Cathy Betts, though, for bringing up the concept of Department of Human Services attempts to break down the silos. For what it's worth, and I know that in many state organizations, silos are almost a natural consequence of funding sources and organizational charts. We really do work very hard to make sure that we break down silos at any opportunity that we can. And testimony to that fact is the amount of time that I spend working with Meredith and her folks within MedQuest. So I wanted to point that out. Also, I wanted to talk about briefly as it relates to homeless prevention and shelter services. As it relates to silos, we work hand in hand with Scott Morishige, from the governor's office, a coordinator for homeless services there, also with Department of Health, Eddie Mercero, and my administrator for homeless programs office. His name is Harold Brackeen. Many of you on the phone may very well know all three of those people, and they are in lockstep in attempting to, during the pandemic, work together to provide the best services out there for folks that are prospectively homeless or those that are needing homeless services and shelter services currently. And also for information purposes, in 2019, we served more than 16,000 people in the homeless programs office, and it appears that this year is trending to be higher than that. So next slide, please. I think it's important to point out the initial applications for our programs, specifically SNAP. And again, to reiterate what Director Betts mentioned, within the Benefit Employment and Support Services Division, we administer the Supplemental Nutrition Assistance Program, formerly known as food stamps. We also administer financial assistance programs, and those would include TANF and ʻOhana. And we'll get into that a little bit more. But TANF is temporary assistance for needy families. Keep in mind, it's a cash program, and the focus always has been on temporary assistance in a cash format for families, meaning there are dependent children. This slide in particular is quite telling in that over the course of this year, what we've seen is a 50% increase in applications for our services, those being food and cash. In addition to that, as Meredith noted, her increase in applications was high. Our increase in applications was also quite high. And from a recipient perspective, we've seen an increase of about 20% in recipients. The thing I think that's important to note, though, is one, on this slide, you can see that 50% increase in applications didn't come at an even rate. There are peaks and valleys to the amount of applications that we receive, which, of course, as you might know, is going to cause any organization a little bit of a challenge in terms of responding as quickly as possible. I think it's also important to note that if you took a look on this chart and noted what the volumes were on weeks 22, 23, 24, meaning May and June, that's what our normal volume is. Those big peaks and the large gains that we had in April and also in October, those are very difficult for any operation to withstand. But what we've done is we've actually used our ongoing business process to help serve our clients in a very timely manner. And so now we did face a little bit longer lead time, but now we're back down to 3 and 4 days for most applications to be processed. So please go ahead, next slide. The SNAP enrollment, meaning those individual households that are on benefits. And you can see most of the time that we saw from January of 2019 up through January of 2020, we had somewhere in the neighborhood of about 80,000 households. And that translates into about 150,000 individuals. You also can see that there was a big jump starting in March, and it came up and it's been averaging well over 95,000 households, and it continues to climb slightly. And so what we see now is about 180,000 individuals that are on benefits for SNAP, just SNAP alone. Next slide, please. One of the other things that we often don't talk about, but you've seen some of it in the news, I'm sure, are the additional benefits that have been provided through SNAP to our residents as it relates to the pandemic itself. And so Pandemic EDC is a program that was geared to respond to the closure of schools. And in schools where students were served either free or reduced price lunches, we found that in some households, that was really the only solid meal many children were receiving. So the federal government then allowed us the opportunity to deliver benefits equal to in value the free or reduced price lunch and distribute those out. It was quite a difficult program to execute. One, it was done very quickly. Two, it also was a coordination with the Department of Education as it relates to getting to the data for address and roles for the individual families in the schools. And the great part about it is through 2 rounds of allotment of the pandemic EDC payment, we've been able to issue out $61 million worth of benefits to families. And emergency supplements just below that in this slide, you can see these are emergency supplements that allowed SNAP recipients who were not receiving the maximum amount based on income. As SNAP is a program that is needs-based, and the more money you make, the less benefit you receive. But the federal government allowed us during these challenging times to issue out emergency supplements so individuals could receive the maximum benefit allowable for their household size. So we also note that $115 million worth of emergency supplements were issued through October for a total during pandemic of $176 million and change, which is a significant amount for those families that are in need. And it also has a significant effect on the local economy in terms of dollars spent in retail grocers. Next slide, please. So, financial assistance program. TANF, again, temporary assistance for needy families, and TAONF is temporary assistance for other needy families. As Director Betts mentioned at the start of the presentation, we are also under statutory obligation to serve residents, not necessarily citizens. And as a result, we have a lot of families that are of mixed citizenship. So this is a program that helps try and level out the supports offered to those folks that are residents and yet not citizens. And you might see on this slide, you can see there's a huge spike in April of monthly applications that went up. And then you'll see that the trend line continues on and shows that they are on rolls and they continue to stay on rolls. Although in this slide, it's showing just the applications. Go ahead, next slide. And this shows on the rolls, indicating this is our caseload per month. And if anything, it's not falling off. It's continuing on. It has everything to do with the current local economy. And I might want to add just at this point, we see a direct correlation between the issuance of unemployment insurance benefits through the Department of Labor and Industrial Relations. And when people go on unemployment, the amount of money that a family or an individual can gain through benefits in unemployment insurance often puts them in a position where they are ineligible for our cash assistance or our SNAP program, simply based on need and based on the requirements of our programs that are dictated by the federal government. One of the things we noticed also, though, is that as unemployment insurance benefits start to expire, and if there's not an extended benefit period, as individual families that still are suffering from the downturn in the economy, if they don't have unemployment insurance benefits to rely on, they become our clients very quickly. And again, these benefits, for the most part, are in the $300 to $600 a month range versus what they would gain on a weekly basis. That would be significant. So by the time families reach me, they're in true need. They're absolutely at federal poverty level. And we do everything we can to serve them as quickly as possible. And we do everything to make sure that they're applying with as much information, and we resolve their application at first contact at every single opportunity. Next slide, please. So the increases as it relates to the cash program can those families that have minor children, and to ʻOhana, assistance for families that are of mixed citizenship. You can see those increases were significant. I mean, starting in February of this year, we had loosely 9,000 or 9,400 families, and now in October we have over 15,000. And to ʻOhana, we're at just under 2,000 families that were being served, and now we're well over 5,000, and it is ever increasing. So the increased percentages are dramatic, and it really shows that our families in Hawaii are truly in need. I also want to give a point out at the bottom. We have this general assistance program. Again, it's temporary disability assurance or temporary assistance for folks that are temporary disabled. And we've seen a huge increase in that as well. And that's going to be something that we're going to have to be studying because it's a block grant and it's a limited amount of funds. And unless we have additional support from the legislature, it's likely that we're going to have to reduce the amount of benefit on that program. So it's in a little bit of jeopardy right now. At any rate, we're very concerned and we want to continue to offer the program because, again, these are individuals and there are 6,800 individuals as of October that are on the program. Next slide, please. So what we found during the pandemic were several things that we had to respond to. And as you might imagine, it's similar to what the service delivery model for MedQuest was. But what we had prior to the pandemic were paper applications. We did not have an online application. We had an application that you could print out, but that was about it. We had a paper application. There was a requirement for individuals to sign that application, a wet signature. There was also the need for individual interviews as well as 6-month reviews for eligibility as required by the federal government. And we had at the time also, as it is a needs program for SNAP, it was a varying amount of benefit depending on the family's income level. After the pandemic hit, several things happened. One, we stood up in a matter of 3 weeks the Public Assistance Information System online application that was a online fillable by the client application that could be submitted directly into the agency without needing to go in and get an application, without having to submit it in the Dropbox for a processing center processing, or also mail it in. So we really tried as quickly as possible to allow folks that were in sudden need to apply. In addition to that, we received waivers from the federal government, from the Food and Nutrition Services Group, as it relates to interviews, and also to allow us to extend certification periods, eliminating the need for eligibility reviews and 6-month review form submittal. We worked very hard to enable our workers our eligibility staff out in the field, 19 offices worth of them, and well over 300 staff to work from home in order to protect them at home and also protect their families, in addition to providing adequate social distancing in our offices. So to do that, we needed to engage our IT group and come up with a hosted UC process for telephony and also a connectivity through our systems, because we have eligibility processing system that's called HAVI, as well as a lot of online document management solutions too, and our interfaces that can verify when clients are submitting information that their information is accurate. Also, we had the SNAP emergency allotments and PEBT that came into play during the pandemic. So we've had a lot of operational changes, not to mention one, from a statewide branch perspective, those offices that determine eligibility, we also rolled them into a singular one non-lobby operational process to leverage all of the staff that are available statewide. As you might imagine too, there are a lot of offices that maybe didn't face the crushing pressure that they did on Maui or they did on Oahu. So we've done so much in a very short period of time to do our very best to ensure prompt and accurate service for our clients. And I'm very proud of the work that our teams have undertaken to try and make sure that we're as responsive as we possibly can. So I think that's the end of my presentation. I would like to hand it over to Maureen with the Division of Vocational Rehabilitation. Take it away, Maureen.
Thank you, Brian. And thank you for this opportunity to reflect how DVR's efforts to build workforce parity for individuals with disabilities and resolve barriers to employment is still an imperative for Hawaii. Next slide. Pre-pandemic, just 39% of Hawaii's residents with disabilities between 16 and 64 years old were engaged in Hawaii's workforce, as compared with their peers, 62% employment rates for non-disabled adults. As you can see, when they are employed, individuals with disabilities are employed in Hawaii's workforce. They're receiving less pay and less hours for their work. And so when we have workforce parity, DVR anticipates this will add $20 million to Hawaii state tax revenues with equal pay for equal work. Next slide, please. Even with employment disparity in Hawaii's workforce, DVR's efforts to strengthen parity represents a remarkable return on investment for Hawaii residents. DVR receives over $13 million annually in federal funding, with the state required matching funds of $3.9 million invested in DVR services. These funds are used to strengthen our participants' skills to engage in employment, retain jobs, and advance in Hawaii's workforce. Pre-pandemic, DVR's participants were engaged in Hawaii's workforce, generating over $3.9 million in tax revenues to the state as a result of their wages earned. They were earned over $48 million annually. This tax revenue, coupled with federal funding, represented a conservative return on investment to the state of 455%. During this economic crisis, DVR has sustained essential services and supported 309 participants to obtain employment at an average hourly wage of $15.28 since March of 2020. And their average work hours weekly are close to 29 hours a week. These participants, these 309 participants, generated over $3.7 million in earnings, their wages, during these past 6 months, adding over $305,000 to the state tax revenues at a time when finding every coin in the couch is critical. Hawaii's return on investment during the past 6 months of the pandemic may have decreased slightly, but the return on investment of 413%, including $702,566 from Social Security cost reimbursements for participants gaining employment over the past year, is still a remarkable return in investing in building workforce parity for Hawaii's residents with disabilities. Again, when Hawaii has equal pay for equal work, this could represent a potential return on investment of 693%. Within the disparities of employment with individuals with disabilities and individuals without disabilities, within that demographic of disability, the demographics of disparity are even more profound, because we can see additional challenges among those residents with disabilities that parallel the American Community Survey infographics shown. Next slide. So among men and women with a cognitive disability, women earn 28.4% less than men. In addition, minorities with intellectual and developmental disabilities were 7% less engaged in jobs, earned 16.5% less than white individuals with these same disabilities, while also having 9% less successful rates with exiting vocational rehab services into integrated employment. Next slide. DVR's essential services, annually funded with federal and state awards, represents an opportunity to strengthen our customers' skills for Hawaii's workforce, advancement opportunities, and careers of their choice. DVR's Disability Determination Branch continues to provide needed resources to individuals with disabilities who are unable to work and eligible for Social Security benefits. The Social Security Administration paid $42.1 million monthly in disability benefits to 46,942 Title II and Title XVI beneficiaries and their dependents in Hawaii, representing federal benefits of over $505 million annually. Last year, DVR's Disability Determination Branch, NVR, staff assisted 28% of Hawaii's residents with disabilities, over 18,000 individuals between 16 and 64 years old, in accessing federal benefits for independent living or engaging in Hawaii's workforce. Next slide. This year, we're celebrating over 100 years of vocational rehabilitation services nationwide, as well as 30 years of the American Disabilities Act and their impact on community integration for Hawaii's residents with disabilities. DVR staff and participants collaborate with community partners, including employers, on fulfillment of competitive integrated employment goals for our customers. Some of the placements attained through these partnerships are noteworthy in our efforts to strengthen workforce parity. We want to leave you with one of our success stories about Amy. Amy is a former recipient of multiple DHS, Department of Human Service, programs. She recently completed graduate school and is engaged in the last steps for full-time employment as a social worker with the Department of Human Services, where she will be able to give back to her community. At first glance, Amy may seem like any other 29-year-old graduate. However, the challenges she has endured along the way and disabilities she manages may suggest otherwise. This hasn't deterred Amy from reaching her goal of becoming a social worker to help children and families in our community. At the age of 3, Amy lost her mother, and by 15, her father. She grew up as an orphan and was raised by her aunts in Kalihi Valley. These life changes combined with the fact that Amy was born with an eye condition that causes vision loss, along with internal organ issues affecting her kidneys, represents the resiliency Amy brings to her story. Throughout her formative years, Amy received vital services from the state of Hawaii's Department of Human Services, MedQuest for medical coverage, Ho'opono services for the blind, a branch of the Division of Oak Rehab, for assistance with counseling, higher education, and employment. Additionally, she received assistance from the Department of Education, teachers of the visually impaired, and orphan services from Liliuokalani Trust. At the age of 14, Amy signed up with DVR to assist with her preparations for life after graduating from high school. DVR provided Amy with financial assistance to help pay for her college tuition and books at Leeward Community College and the University of Hawaii at Manoa, where she received associate's degrees in teaching and then a bachelor's and master's in social work, all the while working part-time at various jobs to help pay for her living expenses. Throughout her journey, Amy dealt with multiple hospitalizations due to her kidney issues, as well as learning how to adapt to the vision loss she was experiencing. Opono's team has been there all along the way to support Amy, who is now in the process of obtaining employment with the DHS as a social worker. Most of the jobs Amy was qualified for required her to have a driver's license, but with the state's support, she has been able to have this requirement waived through the selective placement with her disability. For Amy, life has truly come full circle as she is in the final stages of a background check for a social worker position in the criminal justice system. Thank you.
Thank you, Meredith, Brian, and Maureen. Those were wonderful presentations. Hope you can all hear me. So I just put this slide in here: fight for the things that you care about, but do it in a way that will lead others to join you, by late Supreme Court Justice Ruth Bader Ginsburg. I really appreciate this quote because it not only drives the way we approach this work, but I think you saw in the passionate and collaborative spirit in the previous presentations that that real nature to collectively work alongside our partners to ensure that we can reach where we need to go. You know, none of us chose this work thinking it was easy, but it's necessary. And so we try to show up without ego and show each other grace and show ourselves grace in order to get the work done. Next slide, please. So as a department used to serving some of the most marginalized communities, we anticipated that this pandemic would exacerbate many of the inequalities, from housing instability to increased reports in domestic violence to highlighting the childcare crisis, which many of us know has always been a crisis. But the pandemic really shined a light on a lot of those issues that many of us have dealt with for many years. Also, the lack of supports for working families. So those of us who do this work are not surprised, but we believe it highlighted the need for a multi-generational framework to address the needs of the whole family that's focused on equity and access. And part of that really requires us examining the inequality that remains, and how do we approach this work while recognizing that many inequalities still exist throughout our society and our communities. Next slide, please. So this is, back in July 2019, we participated in scenario planning with the Institute for Alternative Futures. That really opened our eyes to what we would be needing to do to evolve to address the future needs of those we serve, recognizing the inevitability of increased artificial intelligence and use of technology, also addressing the impacts of racism, sexism, and colonialism. So back in the beginning of the pandemic, many of us commented that this exercise really allowed us to anticipate how quickly we would need to move and what we needed to do in order to not only survive the pandemic, but to evolve from it as well. So you can see, imagine the future. These are some of the things that we looked at: impacts of climate change, technology advancement. So part of the scenario planning was, what will Hawaii's future look like in 2035? How will human services be delivered? The pandemic was essentially a crash course. Flash forward to what we would be needing to do to continue to serve the residents that we serve. Next slide, please. So some of the recommendations from that practice, looking at universal basic income, keeping the aloha spirit across community and strategy, beginning the truth and reconciliation process, teaching empathy and compassion, a useful approach to connect with others. And that also flows into some of the trauma-informed care approach that some of our divisions are embracing in order to really ensure that we serve our residents with empathy and dignity. Taking care of the people who take care of others. This is a big one, and this goes back to my comment of showing ourselves and others grace. You know, really reflecting on the work that we've been doing. It's not easy. You know, we're in month 9 of the pandemic, and people are worn thin, people are at capacity, but we can really work together collectively to ensure we get to where we need to go. And as I mentioned before, you know, I really think of a rising tide lifts all boats. So that's kind of the mindset that we've been approaching this work. Reaching out and listening to younger generations, breaking down silos, a lot of this stuff we covered earlier. Next slide, please. So as we move forward, we can use our quick transformation, our work with Institute for Alternative Futures, and our work in addressing the needs of our residents to set priorities for the future. That's really what we've been doing. And any work moving forward must recognize the social inequities inherent in our community and the disparate impacts that this pandemic has had on the people we serve. Here's just some of the impacts we anticipated and are currently working on. As I mentioned, trauma-informed, re-examining diversity, equity, equality, and inclusion into programs and services, setting up our virtual call center to ensure access and one-stop solutions, strengthening our collaboration with community-based organizations and private philanthropy. I think that's absolutely necessary for us to all move forward together. And identifying common data elements and continuing to address cross-sector data sharing and analysis of disparate impacts. Continue to do this work alongside you. We appreciate your partnership and your collaboration with us and appreciate your time with us here today.
Thank you so much, Director Betts. Now we have a few minutes that we can do Q&A, and I'd like to ask Catherine to read first question. Catherine?
Thank you, Mimari. We have several questions in the Q&A. Thank you for your engagement. The first question is for Meredith at MedQuest. What about Medicaid eligibility reviews? Are they still being done?
Thanks so much. It's a really good question. They are not currently being done, only because we've repurposed all of our team's work to deal with that increase in applications that you saw. And because we will not be disenrolling anyone during the public health emergency, we also didn't want to cause any chaos for the people who are on Medicaid. So no, we're not doing them now, but when the public health emergency ends, we are working with CMS to understand how we will unwind from the folks who are on. So eligibility reviews will happen after the public health emergency ends.
Thank you, Meredith. We have one more question, hopefully, that we can address in this time frame, is for Brian. So has the threshold for determining eligibility for SNAP and TANF changed in regards to household income?
Oh, thank you, Catherine. The eligibility elements such as income, they remain the same. The only difference is the additional amount paid. So we're allowing the emergency allotment to then pay the maximum amount for that household that they would be eligible for, effectively assuming no income. But no, the qualifying thresholds remain the same. There's also another question, Catherine, and I guess it adds on to this. Is there going to be an addition to the emergency supplements, or are we going to continue with that? And the answer is yes. We will be continuing on with it. We're waiting for additional clarification and the announcement from the Food and Nutrition Services Group to get the definitive dates and such. But yeah, we will be offering that. Thank you.
Thank you very much, Brian. Mimari, I'm going to be handing it back to you.
Thank you so much. And thank you again for joining us today. Unfortunately, we're not able to answer all the questions, great questions that are posted, but we will provide written responses to each question. And along with the slide deck, we will provide that to the conference sponsors to be posted on the website. And this will conclude our session. And thank you again and have a wonderful rest of the conference.